Hello, everyone. My name is Lisa Douglas, and I am a registered nurse by profession. I am medical surgical certified in my profession as a nurse. I've been a nurse now for over 20 years. I won't say exactly 20 how many years. I started out first as a cashier at a store called A&S. Many of you now changed to Macy's. And I became a nurse's aide. And from a nurse's aide, I obtained my associate degree in nursing. Then I went on to get my bachelor's degree in nursing, and then I went on to get my master's degree in nursing. And my master's is in nursing education, so I have my MSN. I love being a nurse. I enjoy serving in the capacity of a nurse. I've worked from, again, like I said, a PCA to a staff nurse to assistant nurse manager, and now I'm a nurse manager. I've also worked as a clinical instructor for some nursing schools in New York, which I enjoyed very, very much because I enjoy mentoring other new nurses as well. I am big in customer service as my background is working in a lot of VIP amenities unit. But even though working in that capacity, I stay rooted and grounded in the fact that I love to do medical missions on a yearly basis, which I do going back to the island of Jamaica, which is where I was originally born and raised and bred by my grandmother and my aunts, my cousins who have been a great support to me during my career. Many people ask me, why did I become a nurse? And that's a big question. But this has been a lifelong passion since I was a child. I've always enjoyed taking care of others. Even when my grandmother became ill, God rest her soul, her name Ada Brown. Some people call her Brownie. I enjoyed taking care of her as well as helping those that were within the community that needed help. So since I was a child, I've known that. And then when I migrated to the United States, I had an experience as a patient at Hospital for Special Surgery. And the staff there had such an impact on my life that it confirmed that I was definitely going to become a nurse. Not only were the nurses amazing, the PCAs were amazing, the environmental staff, the physicians, and I laid and I said, I am going to be a nurse like them one day. And so I went on to becoming a nurse. Would I change that? Nah. Some people ask me, why don't you be a doctor? I love being a nurse. I love, sitting at the bedside, holding hands, spending a lot of time, talking to my patients, explaining things to them. So I'm very passionate about that. I also love to educate the community because I came from a very poor area in Jamaica. And so education is key to be able to help people to stay healthy and teaching them how to work with what they have to stay healthy. Not everybody has money to pay for the best hospitals and the best medications or to have the organic food or the best of food. And so you make do with what you have and still can live a long, healthy life. Many may ask, well, why did you choose to do a YouTube channel? So one of the things I feel like in doing a YouTube channel is that I can reach a lot of people during my YouTube. It's difficult to travel now, as you know, with the pandemic, to be able to serve in the capacity of medical missions. And so in doing this channel, I'm able to reach a lot of audience, not only those that are back home, but even people that are here that, they may want to sit home and just listen to some medical advice on some things. I'm not an expert on everything, but I ensure that any information that I'm providing, that it is well researched, it is well thought out. I make sure that I get the advice of others. I speak to physicians, nurse practitioners, and I make sure that I get all my information together before I come public to speak to anyone about anything. So I would encourage you to please feel free to subscribe, like, comment, share my channel. You can also leave comments as in any topics that you'd like to hear. So far, I've done topics on the pandemic, on hypertension, on heart attacks, and I'm doing some on diabetes. I'll be doing some on women diseases like, cervical cancer and endometriosis and some other topics that I think is pertinent for people to know about. And I'm also open to you asking questions about, what happens when you come into the hospital? Like, how do we take care of you? One thing I teach my staff, and I'm very passionate about that, is that even though I've worked in the capacity of what's called a VIP setting with a lot of rich and powerful people, everyone is a VIP. You don't need the money to be a VIP. The fact that the God that I serve and I love went to a cross and died for you make you a VIP in my eyes. And so I care for you like I would care for the President of the United States of America, the Prime Minister of Jamaica, or anyone that is considered affluential or powerful, because we bleed the same blood, we go to the bathroom the same way, we love, we hurt, we cry just like everyone else. And so when I walk away from any patient, I want them to feel like they are the queen and the king of the world. And so I'm very passionate about my career. I'm very passionate about what I do. And so that's why I'm going this route with this YouTube channel. So I really hope that you will enjoy it. Again, I hope it will be a blessing, not only to people that are here, but to people that are across the world. I'm hoping to reach a wide variety of people, not only Jamaica, but Africa, Haiti, you name it. I want to reach you. I want to educate you. I want you to know. I want you to know questions you can ask and you should ask when you're in a hospital, when you're not feeling well, what you should do. Sometimes we try to treat things on our own, and it might not be the smartest thing to do. And so we want to make sure that you understand that despite the disparities that we've seen across the world, it is real. Yes, there are disparities among minorities, but there are organizations that have stepped up and say, we're no longer going to tolerate that. And I work at one of those places that is very, very passionate about treating everyone equal, ensuring that every patient is loved and cared for well. I've worked with many organizations that I know do that, such as Northwell, New York Presbyterian, Englewood Hospital. I can speak on those organizations because I, as an African American, as a minority nurse, can say that those organizations support minorities, and they want you as a patient to feel just as loved and cared for as the king of any country and the queen of London. So again, please subscribe, like, share, and comment, and I look forward to seeing and hearing from you. God bless.